by stating that access to affordable and quality healthcare is a right under Article 43 of the Constitution, meaning it's not that we're asking for privileges from the government, but it is a right. Mm-hmm. Now, coming to your question, how have the county governments invested in healthcare? When we look at of course we know that the national government is only under the Constitution, its mandate is referral hospitals and the policy and the research part, but for primary and secondary healthcare, that is devolved. Mm-hmm. When we come to counties, we look at of course when the national government enacts policies, at times we do find that it is a challenge for most of the counties to implement those those policies. But also to your question, I would like to rebut to offer a rebuttal. I do believe that Kenya has invested greatly in infrastructure, the brick and mortar, mm-hmm. the buildings, the hospitals are there. But the question of services, are we offering quality services when it comes to those hospitals? I do believe that many buildings, they do exist, the infrastructure is there, as opposed to what Prof is saying, in my view. But when you go to hospitals, we know we have these dispensaries, of course, in our constituencies, but when you go there, which is of course the mandate of the governors, they've not allocated sufficient money to healthcare. When you go to dispensaries, we do find that there's no water, and water, just basic sanitation is also a very good preventive measure, so that to avoid the diseases to escalate to higher places where you'd need to go to the referral hospitals. Mm-hmm. So yes, we're talking about sanitation, water. We're also talking about power. Some hospitals do not have power, and also when they do have power, the power is not reliable. They probably do not even have generators to offer as a backup. We also see that they do lack basic medication. They lack just the basic paracetamols, just the basic painkillers. And also we also know that counties are understaffed. When you go to hospitals in your counties, you do find it's either the workforce is either very tired, or actually they're not even there. Like, they're not sufficient doctors in there, be it clinical officers, be it nurses, or even the doctors. They're not sufficient numbers, and if they're there, they're probably just overworked. And we've had complaints that doctors are underpaid. So there's that those many challenges which are under the docket of governors, but also it also begs the question, is it the issue of county governments? Do they have the funds, or is it that the national government is disbursing these funds late, so that they probably don't even have time, they don't have the capacity to probably even absorb those funds, or they actually lack the funds? So I do believe that it needs a concerted effort from the government, from the national government, be it in policy, mm-hmm. referral hospitals, in collaboration with the county governments, so that they can offer primary healthcare and secondary healthcare within the counties.
And also the other question is whether the counties themselves actually do